Great. Thank you, Jennifer. At the Poison Center, we noticed an increase in cases of toddlers who were ingesting illicit fentanyl tablets and becoming quite ill. So we examined our local Oregon Poison Center data as well as the national Poison Center data and noticed a large increase in these types of exposures over the last 11 years. Specifically, in Oregon, we had no cases of children under 6 exposed to illicit fentanyl until 2021. We had 2 cases. That number has increased to 16 in 2023. And in the national data, cases increased from only 10 exposures in the country in 2016 to 539 in the country in 2023, a 50-fold increase in about 7 years. So most of these children, greater than 80% of these children, were exposed in their homes. Most had very severe effects, and the average age was 1.5 years old. We are obviously extremely concerned with the findings, and we're here today to hope to increase awareness. We have some initial suggestions for preventing these exposures in the short term. First is any medication or drug that is potentially dangerous to a toddler needs to be stored up and out of the reach of children, particularly or preferably in a locked box, locked medication box, or a locked bag for transport. This is obviously true for things like fentanyl or methamphetamine, but it's equally or maybe even more important for other medications that can harm toddlers, things like antidepressants, heart medications, blood pressure medications, or prescription opioids. The second is if there is opioid use in your house, please consider getting naloxone for your home. Naloxone is a medication that reverses opioid toxicity and overdose. That medication may be used on the person who uses opioids, but may also be used on any family member that accidentally ingests that medication, and that includes small children. And know the signs of overdose and use naloxone if you see those signs. Those signs include sleepiness or loss of consciousness, shallow or slow breathing, or blue color of the lips or skin. Those are all indications for naloxone. And I want to note that naloxone is safe for use in children and that you should not hesitate at all to give an adult naloxone kit to a child. Finally, who to call. If someone is unresponsive or not breathing, or they've received naloxone, please call 911 immediately. If they're having milder symptoms, or if you're not sure if they were exposed to an opioid, or you have questions about opioids or naloxone, please call the Oregon Poison Center. Our phone number is 1-800-222-1222. The Poison Center works closely with local and state public health departments. And to discuss the OHA's role, please turn your attention to Dr. Tom Jeanne, who's Deputy State Health Officer for Oregon Health Authority.
Thank you, Dr. Hendrickson. Good morning. I'm Dr. Tom Jeanne, Deputy State Health Officer and Deputy State Epidemiologist at Oregon Health Authority. Thank you for letting me be a part of this discussion on this very important topic. The increase in illicit fentanyl exposures among young children reported by Drs. Temple and Hendrickson is heartbreaking and tragic. But sadly, it's not surprising considering the widespread availability and use of this deadly drug in Oregon. Like the rest of the U.S., Oregon is experiencing overdose crisis. On average, 90 Oregonians are dying each month from drug overdose. And approximately 2/3 of overdose deaths in Oregon involve fentanyl in 2022. Substance use and overdose are statewide problems, including the Portland metro area, also every county and every corner of Oregon. The number of youth dying from drug overdoses is rising in Oregon, but still represents a very small portion of overall overdose deaths. Because the current illicit drug supply in Oregon is toxic and unpredictable, anyone can overdose regardless of the substance or combinations of substances they're using, how that substance is taken, and the individual's level of experience using that substance. So our message is simple. assume that all illegal substances and any pills not prescribed by a healthcare provider or issued by a pharmacist may contain fentanyl. But it's also important that if you're going to use or you know someone who uses, make sure to take precautions both at home and when you're outside your home to prevent accidental overdoses. When somebody survives an overdose, it's because someone was there and responded. So don't use alone, start low and go slow, carry naloxone and know how to use it. When it comes to children, it's important to take steps to prevent non-medical use of or exposure to opioids, including fentanyl. So talk to children about the risk of drugs, start talking about medication safety early by advising young children never to take any pills without asking you first, store medicine safely, and dispose of leftover medicine. Keep naloxone in the home if you have opioids, and show caregivers, extended family, and friends where it is and how to use it. Naloxone and other opioid reversal medications can be life-saving. In Oregon, anybody can obtain naloxone directly from a pharmacist without a prescription. If you are taking prescription opioids, you can ask your healthcare provider or pharmacist for a naloxone prescription, and your health insurance may cover the cost. Oregon Health Plan provides free naloxone to its members, and those who are uninsured or uninsured may be able to pick up free naloxone at county health departments, some law enforcement, as well as many community-based organizations. If you want to have naloxone in hand for somebody else, again, you can get it from a pharmacist, but your insurance may not cover it. And finally, no-cost naloxone is available for people in treatment for substance use, people actively using opioids, and involved with harm reduction services. I'd like to conclude by highlighting that Oregon's overdose crisis is a result of complex social, economic, and systemic factors. And Oregon is aggressively attacking the crisis with a multifaceted plan intended to reduce substance use and get life-saving treatment to people faster and more efficiently. This includes expanding naloxone distribution and harm reduction efforts to better align with community needs, including through our Save Lives Oregon project, increasing access to medically assisted treatments for substance use, scaling up peer supports and intervention programs across the state, stabilizing and supporting the substance use treatment workforce, continuing education and prevention campaigns. And the legislature last year approved more funding for education for school-aged youth on the risks of substance use. And more funding is being directed towards supplying schools with supplies of naloxone. So every middle and high school in the state is eligible to receive up to 3 opioid response kits, each with 8 doses of naloxone. And finally, we have approximately $266 million of settlement funds from opioid manufacturers, distributors, and retailers that will be paid to the state through the year 2038. And these funds will continue to support substance use and overdose prevention, harm reduction, treatment, and recovery strategies. Thank you, and I'll turn it over to Dr. Bruno.
Thanks, Dr. Jeanne, and thanks, Dr. Hendrickson. I'm Dr. Richard Bruno, Health Officer for Multnomah County Health Department, and I want to share our concerns for this data that's being released as part of this report. I think what's most heartbreaking about this report is that all of these events that happened with these children and babies overdosing are preventable. And so I wanted to make 3 main points today as part of that efforts that Multnomah County and our partners are working on as a response to this crisis. Number 1 is that we recommend that anybody who's taking care of a child or a baby in the home make sure that they're keeping all dangerous substances and objects safe and away from children who may get into them. And so we've mentioned the lock boxes or lock bags as ways to keep medications safe. And that includes prescription medications, over-the-counter medications like Tylenol, or illicit drugs, and maybe in the home, or any paraphernalia, drug paraphernalia that are used, or supplies. And so we have examples of those types of lock boxes here. This is an example of a lock box that can be used in the home. Multnomah County is in the process of purchasing a number of these lock bags as part of a grant that we're received, and so we'll have these available as well for people who want to keep them safe in the home. Thornbecker Safety Center also has lock bags and lock boxes like this for purchase. So we also want to ensure that people who have extra medications around, maybe had some extra oxycodone from a tooth extraction or any expired medications, can get rid of those and dispose of those in a safe way. There are some denaturing bags, some by a company called Terra, which are you can place water and the medication into these bags, and you can seal them. They can't be opened, and they can be disposed of in the garbage appropriately. So those are important to keep old medications away from children as well. The second point I want to make is about making sure to reiterate the points that they made before about having naloxone available. Naloxone is the best way to provide a quick antidote for any opioid overdose. And so having this available is really important. We at the county are ramping up efforts to make sure we're distributing naloxone to as many folks who need it. I think Dr. Jeanne made a really good point that most pharmacies have it available over the counter. It's covered by some insurances. There's many other places that you can get access to naloxone in the community. I would point people to our website, multco.us/overdose-response. And that is a great place that has a list of resources available for people who want to access naloxone for the community. And the third point I want to make is for people who are using fentanyl and want to stop, we want to make sure that people have low barrier access to drug treatment in the community. And so there's a number of places that offer medication for opioid use disorder, such as buprenorphine, whether an oral tablet or film, or an extended release injectable that's given once a month, or it's a methadone that can be given daily. All of these are part of medications for opioid use disorder that can be accessed in various community programs that oftentimes include counseling, drug counseling, as well as recovery programs that people can enter into and start their road to recovery. So we want to make sure that people have access to those. And SAMHSA has a great website that lists available providers in the community. You can also see resources on our website, multco.us/overdose-response. And finally, I just want to say that I'm very grateful to work with our partners at Oregon Poison Center, Oregon Health and Science University, and Oregon Health Authority, as we are all part of the efforts as part of the 90-day fentanyl emergency declaration by the governor and the mayor and the county chair. And so we at the Multnomah County Health Department are ramping up efforts to ensure that people get access to preventing overdoses and also get treatment as well. So wanted to also mention that we have a 24-hour, 24/7 crisis line in case people need to access medications or recovery programs. And that can be accessed by calling 503-988 or 888. Thank you so much for being here.
Thanks for our experts. Do we have any questions from members of the meeting today?
Does fentanyl impact children differently than adults? And if so, how?
Fentanyl doesn't specifically impact children differently, but I think one of the things that was evident in our cases is that all of the Oregon cases were, most of them, I should say, were ingestions of a tablet. And those tablets can contain very large amounts of fentanyl. Mostly they are smoked and smoked, titrated smoking. Child who ingests 3,000 or 4,000 micrograms of fentanyl is 50 times the dose that they should get, which is different from most other people. So really, I think the big difference in adults and children is their size and the dose that they're getting.
And does that do overdose symptoms appear more quickly in children because of their size and they're obviously younger?
Yeah, the overdoses seem to be very severe, I would say, is the main difference. Because they're taking such a large dose for their body size, the number of people, the number of children who required reversal of naloxone was almost 2/3 of these kids. 50% of them had slowed or stopped breathing entirely. So I think the severity is the biggest difference that we saw this year.
I would add that young children are almost certainly going to be naive to opioids, whereas an adult user may have some tolerance. And we're talking about fentanyl, which is a drug that is 100 times more potent than morphine. So that's why it can be so deadly, especially in young children.
what is the timeline like when a child may just fentanyl tablet? Like, how quickly are symptoms going to appear? How quickly does naloxone need to be administered? And if there is no naloxone in the house, is there hope to get emergency crews there in time to save a life?
Yeah, the onset of symptoms are usually going to be within about 30 minutes. Initial symptoms would be sleepiness and then progress to slowed breathing and stopping breathing. So there is a time period where you can access care. So if there's naloxone available, if they are sleepy or so their breathing is slowing, give them naloxone and call 911. If you don't have access to naloxone, call 911 so that they can bring naloxone to you. So there is definitely a period of time where you have the possibility of between the onset of symptoms and the worst symptoms and time when you can intervene.
And I would recommend too, if you don't have naloxone available, you can learn how to do basic CPR to provide rescue breathing for those children who are not breathing. So providing breaths every 2 to 3 seconds for those children who aren't breathing can be a life-saving while in this labs.
I know you said 80% of those cases at 16 in Oregon were exposures at home. Can you tell us what the other 20% were?
Yeah, all of the others in Oregon, we don't know what the exposure was. So it was, for example, a child who was found sleepy, and then we found fentanyl in their urine and reversed their toxicity with naloxone, but we never found out where the exposure was.
And as far as location, is it just Oregon in general, or can you tell us any more specific to it, Metro or anywhere else?
There were cases throughout the state, generally concentrated in urban areas, the population bases.
Now, are the overall exposures to opiates going up, or are we just seeing that fentanyl is kind of replacing all the others that we've seen in the past?
Yeah, it's a great question. So we looked at other opioids, and there's fluctuation with particularly children, but also adult exposures to opioids over time. Over time, we've seen pharmaceutical opioids like oxycodone go down. We've seen fentanyl go up in the last couple of years because of the introduction to the drug supply. We did look at heroin exposures in small children, and we saw an increase during the pandemic, but then came back down, and it's about stable from pre-pandemic numbers now. So it doesn't look like fentanyl entirely replaced heroin as an exposure in small children. We're seeing them both.
I think it's natural for, when parents hear this, they see that fentanyl overdoses are going up. They have small children, they're going to be concerned. People have also heard that, in the city of Portland, there's a fentanyl crisis going on. And when they hear some of these exposures may have taken place outside of the home, I think it's natural for people to maybe want some clarity in terms of, how safe it is for people to bring their kids in certain parts of town when they know fentanyl use is going on. What would you say to that for folks bringing their young kids out in the cities?
Yeah, it's understandable fear, of course. The amount of fentanyl that is in secondhand paper or something you would be exposed to on the street or on the surface is incredibly small and should not lead to fentanyl toxicity. So people should not be concerned about that as far as a casual exposure.
Any treatment people can get, if they have treatment there, is there a quantity that will be harmful for a child versus an adult? And, but what should they give a child? Because that's a lot of the bottle there.
Yeah, it is. So these doses are designed for adults, but it is safe to give an adult naloxone dose to a child. And that has been well studied, and children can tolerate very high doses of naloxone with no or very, very few side effects. So I would not hesitate for a second to give the exact same dose to a child that you're giving an adult, or to use an adult naloxone kit. If the child's not breathing or is has lost consciousness, they need naloxone, and I would not hesitate for a second.
And with these reported cases, did you get this data from 911 or just because they called Oregon Poison Center?
So for our Oregon Poison Center data, it was calls to the Oregon Poison Center. For the national database, it is calls to every poison center in the country. We're not capturing every exposure to fentanyl. Some of them are going to hospitals that have not contacted the poison center. So it's important to understand that the trend is reliable, but the absolute number is not necessarily reflective of the total number of children that are being exposed.
Yeah, because it sounds like your recommendation is to call 911, of course, if there's an exposure. But maybe if they have questions about whether it is an exposure or not, that's when they would call you guys.
Yes, absolutely. If a common thing that we get cases are a pill or medication is missing in the house and we don't know if a child has been exposed to it, we are more than happy to try to work through that with you. If you're not sure if you should give naloxone because the symptoms are very, very mild, that is something that we would be happy to. And we also work very closely with 911 and we can transfer calls to each other and we do so all the time.
How does this data fall in line with children's accidental exposures to other medication that may be left around the house? You know, if you've been around young kids, you know that they're susceptible to putting things in their mouth or tasting different things. Is it because fentanyl is just more prevalent now overall that children are being exposed to this fentanyl now?
Yeah, toddlers put things in their mouth. That's what they do. What we call exploratory exposures, which is finding something and putting it in your mouth, are common. The total number of fentanyl exposures is small compared to all of the other exposures that small children will have. So 16 in a year in the state of Oregon is relatively small. What is remarkable about these cases is how severe they are. The children are exposed when they're ingesting a tablet. They're exposed to a very large amount of fentanyl, which is not common in a single pill with most other things. So if a child ingested a pill, please call the poison center. We are happy to try to work out what kind of pill it was and what the therapy might be and whether or not you need to go to the hospital. If it's the case of a fentanyl ingestion, then we would be sending you to a hospital and getting that.
Sure, and you look at these numbers extensively. Where do you see projecting out in the future? I know it's sometimes hard to say, but going forward through 2024, 25, and beyond, do you think this number is going to continue to rise?
Well, we're going to track. We participate with. We send our data to OHA and the CDC as part of our surveillance system. That's designed to try to pick up these types of unusual instances. We will continue to track our data on pediatric fentanyl exposures. But my hope is that through prevention, I think we all hope that we'll get that number down to zero.
Yeah, sorry, one last thing. I know that obviously it's been such a spike to see, like from 0 to 2 to 16. To see these numbers, I mean, as professionals, what do you think about that?
The numbers of the increase.
The increase.
I think this is related to fentanyl being available in the community. We didn't see pediatric fentanyl cases until fentanyl was introduced in the illicit drug market. I think the difference between fentanyl as a child ingests, it comes in a tablet that has a very large amount of fentanyl, and these kids are getting very, very sick. So the more fentanyl in the community, the more likely it is that a child is going to find the tablet.
And I would agree that it's definitely correlated with just how much fentanyl is out there on the streets. And we have seen a huge spike in Oregon in the past several years. And that has happened around the U.S., but it's only in the past few years that this wave of fentanyl has really hit Oregon and led to that really sharp rise.
Questions based off of that, on a national scale, based on the numbers you were saying, it's nationwide. There's no state that's immune from this. Where does Oregon kind of, I guess, rest on a national level in terms of its overall rise in numbers per capita?
Yeah, if you look in the past year or two, we've had some of the largest percentage increases But that's because we were starting a lot lower than where other states were. Fentanyl took over from heroin in the illicit drug supply on the East Coast 5-10 years ago. But it's been a much slower introduction on the West Coast, or at least more later introduction. And if you look at where Oregon stands compared to other states in terms of our overdose rates, our opioid rates, we're actually pretty middle of the pack. So it's really kind of that sharp rise that we're seeing that is making the headlines.
Sorry, one more from me. What is it about fentanyl that makes it so prevalent now? Why hasn't the numbers of fentanyl tablets out there, why has it risen so much?
Fentanyl is very cheap to make. There's massive quantities coming in through our borders, and I think that's the main reason. It's cheap, it's easy to make, and these illicit supply chains have really ramped up over recent years.
One more question for all of you. You talked a lot about Narcan and not hesitating to administer it. Maybe you could explain how it actually works in the body and why people don't need to hesitate to get it, to administer it in cases that.
Sure. Opioids and fentanyl attach to a particular receptor in your brain. That leads to all of the symptoms that happen from opioids. That receptor is the mu receptor, mu opioid receptor. Naloxone also occupies that receptor and blocks the fentanyl from binding to it. So if you have a fentanyl overdose, giving naloxone will replace that fentanyl with naloxone, so the person will have fewer effects and they will go back. The naloxone in people who have habituated to fentanyl, people who have tolerance to fentanyl and get withdrawal symptoms, they don't use fentanyl. If you give them naloxone, they can have withdrawal symptoms. That is not the case for people who don't use opioids on a regular basis. And so most of these children that we're talking about who accidentally ingest a fentanyl tablet are not going to have tolerance to fentanyl. They're not going to develop withdrawal symptoms. And in that group of people, we have tested naloxone doses that are 10 times more than that, 20 times more than that, with almost no side effects whatsoever. So I feel very, very confident saying that in a toddler, you can use naloxone. Don't hesitate to use an adult naloxone kit, and if you have an indication, get naloxone.
Did anyone else have any questions?
A little show and tell. Yeah. So you saw some other boxes, and just to give a couple of other examples of this is a lock box that's a little bit more heavy duty. That would be something you would have in your home potentially. And then these are the lockable bags we've been talking about. This is something that you would use to transport medications, or a smaller bag to use to carry medications in purse or with your things. So this is great. It locks. It's great for toddlers who they can't figure out the combination. Not great for older kids, of course, but this is not something that's easily you can easily get into. And so this is wonderful for protecting toddlers and children.
Did you want to talk a little bit about Narcan in your lockbox?
Oh, sure. Yeah, so these similar style here with the kind of combination zipper locks there that, when you put the right combination, you can unzip it and you can keep your medication stored safely in here. You can put your prescription medications, any over-the-counter medications that you want to keep away from small children. And so these are great, and these are available in the community. Multnomah County will have these available soon. They're also available at the Joint Vector Safety Center for purchase. And so here's an example of naloxone that you can use to spray up somebody's nose. This is a demo, so it doesn't have any actual medication in it. But this would be you kind of place it up one of the nostrils and just spray all of the contents of the naloxone spray all at once into an adult or a child's nose. You want to wait 2 or 3 minutes before you give a second dose potentially. So In the meantime, you want to be giving rescue breaths. You want to continue to try and rouse somebody, out of that overdose state while you're waiting for 911 EMS to come and help out. If you have extra Narcan, you can wait 2 to 3 minutes, give a second dose if you need to, and continue doing rescue breaths and resuscitatory measures to try and prevent people from expiring.
Great. Well, I want to thank our experts for being here today and talking about such an important topic, and you all for joining us. We'll have the link to the full report available on the OHSU news site today if you want to follow up for some more specifics. And a couple of our experts will be hanging out if you have any follow-up questions for them. But thank you all for joining us.